Thank you, Sean. October is Breast Cancer Awareness Month, a time to heighten awareness about the disease and promote early detection. Early detection is key to survival. Here with more is Dr. Carl Allen with Southwest Medical. Good morning to you. Welcome.
Thanks for having me.
Now, Southwest Medical has a program and a center dedicated to breast care. Can you tell us about this?
We have a breast care program that takes care of these patients with special needs. I want to make sure that every patient understands that the key to breast care is early detection, because most breast cancer, in fact, most of the breast cancer are diagnosed because of an abnormal screening mammogram.
Oh, so when you say detection, it's important for women to go in and get that mammogram, or what about self-exams as well?
What I recommend for patients, anyone over 40 should have a self-breast exam every month and have an annual breast exam with their provider. Also, we recommend at age 40 to have a mammogram every year. And for the younger patient, we recommend between 20 and 39, recommend those ladies to also examine their breasts every month and have a clinical breast exam every three years. Now, this is why this is important, because usually with self-breast exam, when you find something, it's small. And oftentimes, physicians are brought to, the mass is brought to our attention by those exams.
Now, the center can carry out that work, so you can do the exams and seek a professional at the breast care center.
What's nice about the breast care center is if you were to have a mammogram and it's abnormal, or needs some special attention, we can get those patients back in for a more definitive diagnostic test. And what's beautiful about our program is that we have 3 wonderful advanced practitioners that's been certified by the National Consortium of Breast Care Program to do a very thorough breast exam. They will bring you into that center, do a thorough exam, and then at that point, it would tailor what the radiologist does in terms of the additional test. And what's nice about this is that when you have a situation where your mammogram is abnormal, you want that to be resolved very quickly. And we're resolving these issues very expeditiously with this breast care program. And if you were to need to have any additional tests, we work very hard to make sure we get those definitive biopsies within a reasonable time.
Yeah, people don't want to sit there and wait for the results. You can get it back to them very quickly.
Very quickly.
And go over a course of action for them if they need it.
Yes, indeed.
Now, let's talk about mammograms. How many do you do a year?
We do about 39,000 mammograms at Southwest Medical.
Oh my goodness, that's a lot of ladies, lives that you're saving.
We would like to do a lot more, a lot more. That's why we want to encourage all women over age 40 to please come in and get a mammogram done.
Do you find a lot of women are falling through the cracks? They don't know when they should be going, and so they kind of put it off?
A lot of them do, and that's why it's very important with Breast Care Awareness Month to emphasize early detection is the key. And in fact, around my breast care program, every month is breast care awareness. We have a fabulous staff of individuals that really love what they do and embrace these patients with open arms and love and care.
Yeah, and they're there to help, and that's what they want to do.
Yes.
Can men get breast cancer?
Absolutely. I think sometimes we tend to forget 1% of all breast cancer happen in men. And oftentimes, I tell men when I do these presentations that you need to pay attention to your chest. You need to make sure there's no lump under the nipple, especially any bloody discharge. Oftentimes, men are the very least people that want to have a problem, and they don't want to be bothered with that.
Right, so, and they're not aware that they can get it as well.
They're not.
But the difference in men is you will get bleeding then, or something abnormal with the nipple.
Oftentimes, they feel a lump under the nipple and some bleeding.
And you should definitely go in to see your doctor if that is the case. That's something you don't want to put that off.
Absolutely. Anytime something bleeds, you need to go and get seen.
Now, in terms of recommendations for women, can you go through it one more time? Because I think a lot of women also get confused because there's been different information put out there.
Okay. A woman age 40 should have a clinical breast exam every year and also have an annual mammogram every year. Now, I know there's other organizations out there who will say that's not the case, but we've been supported by a number of large medical organizations to support that. And Southwest Medical as well as United Healthcare support that, getting annual mammograms for those women.
And those exams don't take very long, do they?
They don't.
Can you walk us through what would happen in the office when you do get checked out?
What happens is when you come into me as a clinician, I'll do the thorough breast exam. If it's normal, you're fine. You need to have a clinical breast exam because oftentimes, 85% of the time, mammograms pick up on those breast cancer, but sometimes we can pick up on clinical exam those breast cancers. Once you have your exam done, you go to the mammogram unit, and really it takes about 5 minutes. We have a digital mammography unit. It is so quick. And in fact, the staff at one time had me to put my chest into the mammo unit, And it wasn't that bad.
Can men actually go through an exam like that too, like
Yes.
women do? So you would put men through the same machine?
Yes, and also ultrasound as well.
Okay, that's good to know, yeah. Now, you have an event that's coming up so that people can take advantage of the information that you're putting out and get seen by someone.
We have a breast care open house at one of our health center on Eastern and Harmon. It's this Saturday from 8 a.m. to 2 p.m. You get a chance to meet all of our providers, some of the fabulous breast care navigators, as well as our advanced practitioner nurses, some of the mammo techs. It will be free food, free event. Also, more importantly, you can get a mammogram.
You can get a mammogram right there?
Yes.
And again, that takes how long?
About 5 to 6 minutes.
And it can save your life?
Yes.
And when it comes to family history of breast cancer, do you have to go more often if, let's say, your mother or your grandmother had it?
If you were to have a family history of breast cancer, you need to speak to your doctor or your provider because you may be a candidate for genetic counseling and also the BRCA testing, which will slightly increase your chance for having breast cancer.
And what is that?
It's a test that we do to identify patients with higher risk for genetic predisposition for breast cancer.
And that's what Angelina Jolie went through? Is that her testing?
I believe so.
Yeah, I think so too. Well, thank you so much. Some great information for us this morning. Thank you, doctor.
I appreciate you.
Now, the Breast Care Open House is this Saturday from 8 a.m. to 2 p.m. at the Eastern Avenue location. It's right at Harmon. Meet healthcare providers, learn about breast care health and early detection, get a mammogram screening, or schedule a future appointment. Also enjoy free food and great giveaways. To learn more about Southwest Medical and its locations across the valley, check out the website on your screen or call the number listed. Still to come on The Blend, keep it